two of the smartest people I know, Bob McDonald, Executive Director of Public Health and Environment, and Matt Mueller, Executive Director for the Office of Emergency Management. I just want to start by thanking the people of Denver for staying the course over the last several weeks to bring down the spike in cases that happened over the month of July. Keeping the spread of this virus under control comes down to our personal actions, and our residents continuously step up. Even though I know it's been difficult for a long period of time, 2020 will be known as the lost summer for all of us. Though it's more important to stay the course now because we've got our kids going back to school, and we know we are cautious, we're prayerful, but we're also excited to see that DPS will bring their youngest learners back to the classroom starting on September the 8th. But we're going to continue our monitoring of this effort to see its effect on our case numbers. We've seen what has happened in other states, particularly with regards to college campuses, and we'll continue to watch that situation as well. We are also, of course, all very aware that we're about to go into our Labor Day weekend. And while we usually look forward to our end of the summer celebrations, we can't celebrate with the same big groups and backyard barbecues this year like we usually do. If we keep doing what we're doing, we're going to be able to see fans in the stands sooner than later for our sports teams. And I know that I'm not the only one who hopes and looks forward to maybe seeing a Broncos game in person this season. So please continue to wear your face covering, wash your hands, maintain social distancing, and don't gather in large groups. We need to stay the course and keep ahead of this virus. Now, Bob is going to go over these in more detail, but I wanted to give a quick rundown of where we are currently. Our hospitalization rates remain low and flat. Our ICU capacity is still stable. Our percent positivity rate is still in good shape. It's much better than what we saw in the month of July. And the rate of new cases has been steadily declining for the last month. If we can hold steady at this level for another week, we can start to resume discussions with the state about additional variance requests. But frankly, while our cases are declining, we are nowhere close to qualifying for the next phase of the state's reopening plan called Protect Our Neighbors. We still have a lot of work to do. We're also continuing to ramp up our community-based testing efforts. This has been important since we started this journey back in March. As I mentioned a couple weeks ago, the goal is to get more of our testing out into communities and to remove barriers to access. We have been trying to bring down those barriers in a variety of different ways, including mobile testing, pop-up testing community events, and food giveaways. We've been doing this in partnership with a lot of community organizations, and I want to thank those organizations who have been just very reliable and tremendous partners with us over the last several months. With that, I want to bring up Bob McDonald, who will go in deeper detail again on our vital statistics. Bob?
Thank you, Mayor. I want to thank everyone else who's able to join us this afternoon, actually. Historically, when I've given my updates, I've often started with the epi curve, showing how this virus has responded to the work that we've done. But I want to back up a moment and just share some of the work that's being done behind the scenes to protect all of our citizens. These are things that we don't often talk about, and I'm just going to spend a little bit of time on it. We often talk about compliance. I want to point out and thank everyone, to the mayor's point, citizens, venues who've just stepped up and complied. And you can see here that we've done thousands of visits to assure compliance with our public health orders. We have some level of noncompliance here, and it would seem like that's a low level of noncompliance, and it is, but I want to stress that even just a little bit of noncompliance can result in an outbreak that then leads to transmission to many other people. We investigate outbreaks. We have outbreaks within the pandemic. So as we're trying to manage the pandemic, outbreaks come to our attention where we're starting to see a cluster of people within a certain type of venue, whether it's a long-term care facility or business office. we investigate those immediately, and we implement controls to keep those small clusters from contributing to the larger pandemic. And then, of course, to the mayor's point, we've done a lot of testing, 90,000 tests to date, much of that done from the Pepsi Center. But I want to stress that we have done testing at over 100 sites in the city of Denver. We're going to continue to transition from the Pepsi to more localized testing sites to reach our most vulnerable people. And then, of course, the Wellness Winnie, that mobile service unit that we provide. We've done hundreds of tests at people's houses. If they cannot get to where they need to be to get a test, we're going to go to them and get that done. Case investigations currently average about 49 to 50 cases a day. Our partners at Denver Public Health investigate those. They get contact tracing information, and then they provide that to us. They're pretty quick with completing those cases, and then as you can see here, we take that information from those cases, and we've made thousands of calls, and we don't just call. We realize that these days people are a little nervous about answering the phone. They don't know who's on the other end. We call, we text, we email. We do everything we can to reach those contacts, and we're almost at 90% with reaching people within the first 24 hours of receiving that information. So here's the curve that you've seen, and I've explained this before, that very early on you start to see the first spike back in early April. The mayor authorized a stay-at-home order, and we put some public health controls in place. And generally, you see about 3 to 4 weeks for this virus to respond to your efforts, to our public health controls. And so you see the curves start to go down again. And in this phase here, there's less physical distancing. Variances are granted. Things are opening back up. And then you see the virus responds again and starts to peak. So we stop submitting variances. We implement more public health controls. We step up compliance, and the virus starts to go down again. One of the things that we look at very closely is the positivity rate of all the testing that we do. And you can see very early on here it's fairly high, because you might recall that in the early stages of the pandemic, we were telling everybody who's symptomatic you need to get in and get tested. We limited it to that because testing supplies were limited. We have more testing supplies now, more capacity, so the more people are tested, the positivity rate goes down. The mayor had mentioned hospitalization rates still staying very low. We're seeing a different demographic that we saw in the beginning of the pandemic, where it was largely the elderly population that was being impacted the heaviest from this, and as a result, hospitalization rates went up. It's a younger demographic now. We're seeing more of the 25 to 35-year-olds now that venues that they are often frequent are open now. There's less physical distancing among that demographic, and now we're seeing more cases in the younger population. And a subset of hospitalizations is ICU bed capacity. Again, we're trying to keep it under 80% here. Our hospital partners have been very good at managing their systems, building out capacity in case there's another spike. We feel good about this one. If the case rates continue to affect younger populations, I suspect we'll be pretty successful with keeping these numbers down. We want to keep it below 80 and certainly below 90%. Those 4 triggers that I went over, those are all things that we would look at to consider re-implementing some of the public health controls that we saw in the beginning of the pandemic. And as I stressed before, we stood up the Pepsi Center with many, many partners, Department of Safety and many others. Here's the Pepsi Center here, and then you can see we built out some other testing locations, primarily focusing on underserved communities. And we're going to continue to do that. That has been a focus from the beginning. Persons experiencing homelessness and other vulnerable populations, we're going to keep moving in that direction. Along those lines, you can see that we have some locations here that we'll be at conducting testing events. Certainly don't need to jot this down now. You can visit the city's website here, and all of our testing information will be on there. And with that, I get that question a lot. If things are looking pretty good right now, can't we ease up? Absolutely not. I know these things are sometimes strenuous to comply with, and face coverings are sometimes a bit of a hassle, if you will. But we've got a number of things that are on the horizon here that we need to be aware of. Of course, school's going back, K through 12 and post-secondary school. They're going to start reconvening, so there's going to be less physical distancing there. We have a holiday coming up, and I would ask everyone, certainly celebrate, but celebrate in small numbers, ideally with your family members. We have cold and flu season. It's going to be hard on our hospital systems to manage the pandemic and then manage other respiratory illnesses that we see at the same time. And then the other thing I would add to that's not on this list is that respiratory viruses generally do better in colder climates. And so COVID-19 is likely to spread a little easier in the fall and winter months than perhaps in the spring and the summer. So again, I just want to stress, we're not out of the woods yet. We're doing a good job keeping numbers down. But I want to stress, particularly to the younger demographic, if you will, that's where we tend to see less compliance with face coverings. And I will share, it's generally more male than female. So, gentlemen, I want to ask you, help us out. Wear those face coverings when you're out having a good time in the evenings, and we'll get through this. And with that, I'll turn it over to my colleague, Matt Mueller.
Thank you, Bob. And I'll say to everyone, even though we are still in emergency response mode, we continue to plan for long-term recovery. And that planning has been focused on support for our workers, businesses, and workplace safety, addressing public health disparities, and ensuring community feedback and equity in our recovery efforts. This work has been co-chaired by former City Council President Albus Brooks and my Chief of Staff, Alan Salazar, and engages nearly every agency directors and outside partners such as DDP, Denver Downtown Partnership, Visit Denver, Denver Housing Authority, and Denver Health and Hospital Authority in helping us to develop our strategies. City Council was briefed last week, and we want to make sure that our residents know the plan has goals and measurable metrics. It's our roadmap to get the city and county of Denver safely past COVID-19. This recovery action plan is online right now at denvergov.org/COVID-19 for residents to view, and we encourage you to go online and to see where we are, our blueprint for recovering as a city. We invite everyone to give us feedback on the plan as you've read it. We'd love to hear from you. So more on our long-term recovery efforts, I want to turn it over to Matt Mueller, Executive Director of Emergency Operations.
Thank you, Mayor. So during the early days of COVID, we activated the city's Emergency Operations Center and Joint Information Center to meet the city's emergency needs. We were activated for 3.5 months to meet the demands of the emergency. As the emergency needs began to decrease, our cases and hospitalization rates came under control, and we were able to obtain key PPE, personal protective equipment. Our long-term recovery and community recovery needs have begun to increase. To meet these recovery needs, we stood up a long-term recovery committee to guide the city's response and recovery through COVID. To ensure we have a clear and measurable path to recovery, we have developed a recovery action plan to guide us and keep us accountable. The recovery action plan is a detailed operational document that addresses the highest priority recovery needs, things such as sheltering, public health interventions, small business and nonprofit assistance, and government and business reopening guidance. This is a living document. As the recovery needs change, the plan will adapt and change with it. Additionally, every task in the recovery action plan goes through a thorough equity review process by the city's Equity, Diversity, and Inclusion team. To date, 28 of 78 tasks across 9 objectives have been completed. Some of the tasks will take weeks to complete, others months, and still others will be ongoing throughout the duration of COVID. Finally, I'd like to address community engagement within long-term recovery. As the mayor mentioned, the Long-Term Recovery Committee is chaired by former council member and Denver resident Albus Brooks, along with the mayor's chief of staff, Alan Salazar. This is to ensure we have both community and governmental representation and engagement in the committee. Additionally, members of the committee and its working groups include representatives from our schools, healthcare community, housing advocates, trade industries, and not-for-profit organizations. These members don't just provide input, but they're actually part of the implementation of the plan. I encourage all of you to review the Recovery Action Plan by going to denvergov.org, and additionally, you can provide feedback by emailing covidrecovery@denvergov.org. Thank you.
Thank you, Matt. Now, I'm sure before we get to question and answers, because I'm sure that you all have some questions for Bob and Matt or myself, I want to address one issue. I receive a lot of questions about the boards that are up on the city-owned buildings, McNichols Building, the Civic Center Park, and the Capitol here, City Hall. I want to share with you that these buildings are designated National Historic Landmarks. And so it means that means that we just can't go out and talk to Lowe's or Home Depot or Fly or any type of any contractor and say replace these windows. There's a lot of work that we have to, and a lot of policies and rules that we have to comply with in replacing these windows. These are not cheap windows. They're about $3,150 per window. That's just the window on our buildings. But there are other issues that we have to deal with. We have to make sure they comply with our National Historic Landmark standards. And so we're doing all of that. At the same time, we have a great team over at the Department of Transportation Infrastructure that are working hard to clean up graffiti and to make sure we stay steady on our pathway back to restoring this city to the luster and the excellence that we all hold in terms of our standards. And so we're working to accelerate these repairs and the cleanups, as well as thank our general services team that is leading the effort to make sure we are properly replacing these windows. But one of the things that we're doing, and I want to share this with you, is that we are partnering with Denver Public Schools and a couple of our arts schools to have students decorate the boards for us while they're still up, so that they just don't look plain and like wooden boards. And these young people are being asked to bring a piece of art that they can put on, or they'll paint on the boards, that will really share their thoughts and pride in terms of their residency here in Denver, Colorado. And so you will have more information about that coming very soon, but I want to share with you that I'm excited Denver Public Schools and the School of Arts have leaned in and have graciously agreed to partner with us to decorate these boards while they're up and while we work to comply with the National Historic Standards. Let's open up to question and answer, and we'll get started. Anyone online?
Anyone have any questions?
I have one by phone.
Go right ahead.
Hi, this is Rick Salinger from Channel 4, and I'd like to direct my question to Bob McDonald, please.
Bob?
Good afternoon,
Can
Rick.
you hear me okay, Bob?
Yep, they can hear you just fine. Go ahead.
Okay. Some 462,000 people attended this year's motorcycle rally in Sturgis, South Dakota. Undoubtedly, a great many of these people came from Colorado. Would you suggest that these people get tested, given the fact they didn't wear many masks there?
Yeah, Rick, I appreciate your question. I think before I make a decision, just like many decisions that we've made throughout the pandemic, I would want to get a little bit more information before I just jump to that conclusion. I think it's certainly, one of the things that I'd consider is, what's the infectious rate up there? I'd want to know a little bit more about the event. Certainly, it's a concern for us. It's something that we would address and would not allow here in the city of Denver. I think it's a legitimate question and something that I'd consider, but I would want to look into more, get a little bit more information before I just jump to that conclusion.
Well, the CDC, as you know, changed its guidelines suddenly, saying you should only be tested if you show symptoms, not if you're asymptomatic. Mm-hmm. And there were a great many cases up there reported, and was wondering if you would suggest going against the CDC guidelines and seek a test even if you are asymptomatic.
No, I think every step of the way we've adhered to the CDC's guidance. Again, I believe your question was what I suggested everybody from Colorado that went to that event get a test. I think that's a legitimate question, but again, I'd want to look into that a little bit more, and then discuss with our chief medical officer, get his thoughts, and then make a decision on that.
Thank you.
Next question on the phone.
This is Vinny Del Giudice at Bloomberg News in Denver. Can you hear me?
Yes.
Hi, this is Vinny Del Giudice at Bloomberg News in Denver. Mayor Hancock, How is the supply chain for COVID-19 supplies with autumn and winter nearing? Masks, other PPE, testing equipment, and how is FEMA support and support from other outside agencies? Thank you very much.
Thank you, Benny. I'm going to bring up Matt Mueller, who can answer that question for you.
Thank you for your question. So as you all remember, in the early days of COVID, the supply chain was extremely tight. It was very difficult to get supplies, particularly masks, N95 and surgical masks, as well as gloves, gowns, face shields. With that, we had some assistance from the federal government through the Strategic National Stockpile, but soon it became clear that we had to procure most of what we needed on our own. And we put through a robust effort here in the city over the last 3 to 4 months to procure what we needed to support not only within the city, but our partners, our nonprofit agencies, whatever we could do. Since that time, we have built a supply that we are retaining in the event that we see an uptick in cases and we see another shortfall in supplies. But right now, the good news is that generally PPE is fairly available, not in all cases, but in most cases, and we're in pretty decent shape.
So we're better off than we were back in March and April.
Yes, I think it's fair to say that we are in a better position right now in terms of our access to PPE within the city than we were back in March and April.
Thank you very much. Thank you very much.
I'll just add to that, Benny, that I sounded the alarm in March, April, and somewhat in May about the dire situation we were in. We were in regular contact with our hospitals, and they shared their challenges in terms of serving the people. So we just want to remind you that Matt and his team have done a tremendous job in partnership with so many partners out there to help us to begin to really replenish, but also to grow the supply here in Denver.
Thank you very much, sir.
Next question.
Hey, Mayor, this is Esteban Hernandez over at Denverite. Can you just talk about other steps that the city's taking to prepare for a potential spike? Because it sounds like the city is basically preparing for another spike like we saw after Memorial Day. So can you just provide more details about how the city is preparing for that, and if there's pretty much a guarantee that we're going to see another spike again?
I will invite, of course, Bob to share in this question with us, Esteban. But let me share with you, one of the things that we've always warned against, of course, as we enter into the fall is the presence or the introduction again of the flu virus in conjunction with COVID, which causes us a great deal of concern. As people get back, particularly our young people get back to school, some folks may even go back to work after the summer, since not being in the office since March. We, of course, stand the possibility that we will have these two viruses in the space, as well as more movement of our young people who can also carry the virus and transmit it. So that's always been a big concern during this time of year for us. But I can tell you the biggest thing we're doing is trying to remove the barriers to testing. Not only continue to share information about face coverings, washing hands, and social distancing, and maintaining those strict protocols, but also moving testing from just the Pepsi Center to our communities and try to remove those barriers to testing so that we can monitor, of course, the infection rates, but also contact tracing. Anything additional you'd like to add to that, Bob?
Thank you. I would only add that, there's no one department, there's no one government, if you will, that is going to handle this without a lot of partnerships. And so we work very closely with DPS, our healthcare providers, to make sure that they have their plans in place, not just the city's plans. All of our partners, Denver Public Schools, post-secondary, healthcare providers, they all have to have their plans in place too should we see another spike. And we work very closely with them along those lines too. And the mayor mentioned flu season. We're looking at building out capacity for vaccinations at testing sites. We hope that we can get that done so that we can use the infrastructure that we already set up to increase vaccination so that we're not dealing with high case numbers with both types of viruses.
Does does that mean that the city is going to launch some sort of encourage people to get vaccinated or something like that? Is that something we can expect from the city's public health department?
Absolutely. We're partnering very closely again with Denver Public Schools and our medical partners at Denver Public Health to not just launch a campaign, but again to build out that infrastructure to make it as convenient as possible for people to get vaccinated in the course of their, the things that they do throughout the day. So watch for more on that. Flu season officially starts in September, and we're going to be ready for that.
Next question on the phone.
Hey, this is Gabrielle Franklin from KDVR here in town. I have two questions. The first one being just as everyone is looking forward to sort of expanding testing from outside of the Pepsi Center and moving more forward to other parts of town, are we confident with the turnaround time when it comes to testing?
Yeah, thank you for that question. Turnaround times with testing, it's that's key because contact tracing and everything that we do in response to cases to try to control outbreaks that I mentioned earlier, or just the spread of the virus, it all is key on quick turnaround times. Right now, I believe we're still at about 2 days. That's at the Pepsi Center. It's also at those locations that you saw on the map earlier. I'm confident that we can still do that, but I think what's key to that is being thoughtful about transitioning from the Pepsi Center to additional sites. We're working very closely with our partners at Denver Health and Hospital Authority to build out more capacity in addition to what we've already done.
Last question.
Okay, I have an off-topic if the mayor would.
I'm sorry?
She said she has an off-topic question. Go ahead.
Okay. We've had police tell some of our reporters that some of the people who caused trouble at Wednesday's homeless sweep were also involved in some of the violent events this past weekend. So do we have any more info about where these people could have come from? And is there concern about, maybe they could be bringing the virus with them as they're coming into town?
Well, to the latter part of your question, anyone who comes from anywhere outside of Denver or Colorado, we obviously are concerned about carrying the virus into our community. And so that's always concern. I cannot comment on who these individuals are. I think it's a better question for the Denver Police Department. Obviously, in working with DPD, they are out on these cleanup efforts by the city in terms of our encampments, as well as, of course, in these protests that are occurring on our streets. And they, you see people repeating, or at least they recognize folks from these events. And so it would not surprise me if we have a few folks. I cannot personally confirm that. It will have to be DPD.
Okay, thank you so much. Anything else? Anybody last questions?
Yeah, I have one if that's okay. Mayor, this is Ed Seelover with the Denver Business Journal. We understand that Governor Polis is going to issue new guidelines for indoor events tomorrow. I'm guessing you've probably heard pleas from the hotel community here in Denver to loosen that up. Has your office been involved at all in working with Polis or working with the hotels to see if they can expand indoor capacity, or have you all put any thought into whether that's something you'd like to see?
Yeah, Ed, we recognize and have remained in continuous conversations with not only the hotel but the entertainment or special event sectors of our economy. They're critical for our economy, and they recognize there's some opportunities there. And so, yeah, I've had conversations directly with the governor, with his chief of staff, and we've had ongoing conversations between our public health departments about the gatherings of small groups or medium-sized groups and how we can manage them and help our hotels and our special venues get back into the game there. So this is a critical point, but we also, let me remind you, though we want it to return in a good way, we want to be smart about making sure that people can socially distance, can make sure that people are following the strict protocols necessary to keep everyone who enter into those facilities safe. But I got to tell you, it is critical for the economy. You begin to see very quickly how the economy is impacted when you can't allow certain number of groups get together. And I'm not talking thousands. It could be tens of people who come together. And those are dollars that the economy does not see anymore. But I speak from a civilian in public health, and looking in and getting advice from great people like Bob McDonald and the state, and also on the economy. But I'll ask Bob if he has any thoughts or comments on that as well.
You know, I don't know that much to add except to say that, you know, those interactions with the state health department and the governor's office, you know, they happen every day. Every day we are talking with them, our city attorneys with their attorneys, our public health experts with their public health experts. So we have multiple subject matter experts connecting with the state every step of the way so that we're in sync with each other.
All right, thank you all.
Thank you, everyone. Thank you all.